In this video, we are going to explain how hemorrhoid artery embolization is performed at the Florida Interventional Institute. First, a catheter, or a thin plastic tube, is inserted into an artery in your groin or wrist. Using X-ray guidance, the catheter is advanced into the arteries that supply blood to the colon and the rectum. Next, a smaller tube, called microcatheter, is introduced through the main catheter and is carefully navigated into the specific branches that supply blood to the hemorrhoids. Once the microcatheter is positioned close to the hemorrhoids, tiny beads, smaller than grains of sand, are released to block the small branches. Then, a small coil, which is a specialized device to block the blood flow, is placed in the artery to further ensure long-term occlusion of the branches. Without the blood supply, the hemorrhoids gradually shrink over time and then disappear. If you would like to learn more, please call us or visit our website at flinterventionalinstitute.com.